There are many ways that a new mom can prepare for breastfeeding while she's pregnant, especially if it's her first pregnancy and breastfeeding is going to be a new experience for her. And the key piece of that is education. Women who educate themselves about breastfeeding and take some classes, read about breastfeeding, are going to be more prepared when the time comes and be more ready to address any obstacles they might face.
Mastitis is essentially an infection of the breasts. And it happens, and it's specifically an infection of the breast that happens it can actually happen before delivery, very rarely, but it can happen before delivery as well. But we talk about the peripartum, around time of delivery period. I tell moms it feels like the flu, it's the flu with your breast hurting on top of it. So oftentimes you have a fever, you can have muscle pains or muscle aches or soreness, kind of like when you have the flu, and your breasts are unbelievably tender. Those are the three hallmark things. Occasionally, you can also see redness or warmth in your breasts as well, and it may also be difficult to nurse during this period of time. It's treated simply with antibiotics. It's a pretty easy fix.
So thrush is a fungal infection that can occur in the breast. It, like mastitis, is usually diagnosed clinically based on the appearance of the mother's breast and the symptoms that she's experiencing. The mother will usually experience sharp stabbing pains in her breast, and the breast will have a shiny redness appearance to it, usually not a fever. It's important that if a thrush infection or fungal infection of the breast is diagnosed, that the baby also be treated, because the mom can pass that fungal infection to her infant and they can pass it back and forth. There are some treatment options for sore nipples. One is a woman can actually express some of her breast milk and rub that into her sore nipple and then let it air dry. It's important to let the breasts air dry after feedings and not to apply lotions or creams to them, because those can actually cause sore nipples and further any nipple trauma or damage. Now, sometimes there are an antibiotic ointment that can help with sore nipples, and that is sometimes prescribed if we actually see nipple trauma or any open wound on the nipple. But most of the time, those creams are not needed. You can also apply warm or cool compresses to sore nipples, whichever feels better, and that sometimes helps. Usually, sore nipples resolve in the first week postpartum and get better, but if they don't, then it should be addressed.